Hi, my name is Gallagher. I am a plastic and reconstructive surgeon with a special interest in gender affirmation surgery, and probably my most favorite surgery to do is masculoplasty, which is our version of female to male top surgery or transmasculine gender affirmation surgery. I have another video about what exactly is involved with masculoplasty if you'd like to check that out. But in this video specifically, we're going to talk about what to expect now in the weeks and months after gender affirmation top surgery, and what you can expect once the dressings are removed after the nipple reveal. And so we're going to take it up from around then. So usually the nipple reveal is done at about 6 to 7 days, so about a week after the surgery. It's absolutely nothing to worry about. Usually you don't feel much at all, and just we take the little dressings off, which are stitched on. These are the only stitches we ever remove. We have a video of it. It's really not bad and nothing to dread. So I would say in the first few weeks after surgery, the most important thing, or what patients are most focused on, is their nipples. And so what nipples do in this phase is scare people. So they look weird, they look freaky, they do strange things, and I would say the vast majority of patients get really scared by how these nipples are looking, and we get a lot of photos and calls over this. And again, we always encourage our patients to ask, because this can be a really scary time when your nipples are looking frankly dead. So when a patient comes in to have their bolsters removed, again, it's not very painful, about a week after surgery. And I always warn patients that the nipples are going to look, not very happy at all. So nipples will do a range of things when they're recovering from being moved. So, of course, during the surgery, we take off the nipples, oftentimes completely deconstruct them, masculinize them, and put them back on where they belong. And during this jump, a patient will need to find its new home and take as a graft, and it can look quite scary while it's doing this. And oftentimes we'll get what's called epidermolysis, so that means the very shallow layer of the nipple itself will die off and come off. Sometimes it'll scab off, and the healthy nipple will come through underneath. So during this time, I recommend patients, and we instruct you exactly on how to do this, to put an antibiotic ointment on top of the nipple. This does a couple of things. It softens those scabs, it encourages healing, and of course prevents nipples from getting infected. This is exceedingly rare that this would happen, but just in case, it's nice to have the antibiotic in there. We recommend any sort of topical antibiotic ointment, so it can be Neosporin, Bacitracin, and triple antibiotics. That's not important. The most important thing is that the patient isn't allergic to anything that's in the ointment. So typically our patients are doing this for about 2 weeks after surgery, about twice a day, and we put some band-aids on there. So how are you feeling during this time, apart from being completely freaked out about how your nipples look? Other things that can freak you out or freak our patients out is there will oftentimes be a lot of swelling there. There may be the appearance of dog ears both in the center and off to the sides that will often go away as that swelling decreases. Sometimes the patient may find a little dissolvable suture poke through at one end or the other. Again, super common. If it really annoys the patient, we can certainly trim it away, but usually these will begin to dissolve pretty quickly. Most of our patients will go back to work at about 2 weeks. However, if you have a job that involves a lot of heavy lifting, you're not able to go back to full activity for 6 weeks after surgery. 6 weeks after surgery, you should be safe as long as you're feeling okay and your healing has been normal to go back to workout. So I always say ease it in. Oftentimes some soreness in the chest is still very common even this far out. So in the weeks and months then, as things are healing further, you're beginning to see your results in the mirror. a lot of patients will get strange symptoms as their nipples and their skin begins to wake up. So usually after surgery, you'll have big patches of skin that have no sensation at all. This is very, very rarely permanent. However, it does take up to a year for that sensation to grow back in. So your nerves are growing back in from the edges, and oftentimes this can lead to pretty weird sensations as it's coming back in. The most common is what I call the lightning bolt, where a patient will be just, watching TV, hanging out, and suddenly there's a really weird sensation as their nerves are wakening up. Oftentimes, when a patient goes out in the cold, they may notice their nipples are particularly sensitive. We know about 80% of guys regain sensation in their nipples. Some guys will even get pretty sensitive nipples afterwards. And really the most reassuring thing is as the nerves grow back in, they'll settle down and stop acting weird, although this can sometimes be up to a year or more after surgery. So this is just what to expect in the first few weeks and months after top surgery.